Hello class, my name is Jocelyn Moore and I'll be discussing the topic of stroke. Every year, more than 795,000 people in the United States have a stroke, killing nearly 130,000 people a year. On average, one American has a stroke every 40 seconds and someone dies from a stroke every 4 minutes. Stroke is the leading cause of serious long-term disability. But what is a stroke? Stroke is known as a cerebrovascular accident or CVA. It is caused by an inadequate amount of blood being delivered to the region of the brain as a result of a disruption of the blood supply. There are two main kinds of stroke: ischemic stroke and hemorrhagic stroke. An ischemic stroke is the most common form of stroke. About 85% of all strokes are ischemic stroke. Ischemic stroke occurs when the artery that supplies oxygen-rich blood to the brain becomes narrowed or blocked, resulting in ischemia. There are two types of ischemic stroke: thrombotic stroke and embolic stroke. Thrombotic stroke occurs when a blood clot, a thrombus, develops at the site of occlusion and prevents proper blood flow. Fatty deposits known as plaque can then build in the arterial walls and block oxygen and nutrients from reaching the brain. A blood clot that traveled from another area of the body in the bloodstreams to then lodge in a blood vessel is called a embolus or moving clot. When the embolus lodges in the cerebral artery and occludes blood flow, it results in an embolic stroke. It is difficult to distinguish between the two types of strokes in the field since they may present similar signs and symptoms. Emergency treatments include medicines like tissue plasminogen activators (TPA), anticoagulants, and antiplatelets, as well as surgical treatments like carotid endarterectomies and angioplasties. Hemorrhagic strokes occurs when the arteries in the brain leak or rupture, resulting in hemorrhage. There are two types of hemorrhagic stroke: intracerebral hemorrhage and subarachnoid hemorrhage. Intracerebral hemorrhaging occurs when a blood vessel within the brain bursts, allowing blood to leak inside the brain. Subarachnoid hemorrhaging occurs when a blood vessel bursts in the space around the outer surface of the brain, known as the subarachnoid space. Treatment for hemorrhagic stroke will depend on the cause of the bleeding and what part of the brain is being affected. Bleeding can be caused by high blood pressure, use of blood thinner medications, head trauma, aneurysm, or arteriovenous malformation. Treatments include preventative measures such as controlling blood pressure and ceasing to use anticoagulants. Transient ischemic attack (TIA) is known as a mini stroke as the flow to the brain is only temporarily interrupted. TIA develops most of the same signs and symptoms as those experiencing a stroke. In contrast to a stroke, TIA does not produce permanent neurological deficits. A stroke is diagnosed based on your present signs and symptoms, past medical history, a physical exam, and test results. One or the more following tests can determine the brain area being affected and what type of stroke has happened. Diagnosis can be seen by viewing changes in tissue densities in the brain or blood vessels. The signs and symptoms of a stroke are depending on what specific area of the brain has been affected by a disruption in the blood flow. A sudden development of one or more of the following symptoms usually indicates a stroke, such as severe headache, paralysis or weakness to the face and or extremities, sudden confusion, trouble seeing, speaking or understanding, behavioral changes, and so on. The acronym FAST is a way to remember the signs of strokes and can help identify the onset of strokes more quickly. F. Does one side of the face droop? A. If the person tries to raise both their arms, does one arm drift downward? S. Is their speech impaired? T. If all of these signs are present, it is time to call 911. Some people are at higher risk for stroke than others. The following are just a few potential risk factors for stroke. For example, high blood pressure, heart disease, and smoking. These factors all affect the properties of blood flows and can contribute to arterial blockages and later hemorrhages. Adequate daily exercise and proper diet can prevent strokes from occurring. Quitting unhealthy habits such as smoking will also help prevent strokes by preventing blood clots. Thank you for watching this video. I hope it was informative. I leave you with a list of references for further reading. Thank you again for watching.